The following informative discussion on COVID-19 is brought to you by Excellus Blue Cross Blue Shield.
Welcome to another informative discussion on COVID-19 with Guthrie and Arnot Health, brought to you by Excellus Blue Cross Blue Shield. I'm your host, Frank Akam. On today's program, we'll be talking to the experts at both Guthrie and Arnot Health. We'll start first with our friends at Guthrie. Thank you for joining us again, and would you please introduce yourselves?
Hi, my name is Joe Scopoletti. I am the president and CEO of the Guthrie Clinic.
And I am Michael Scalzone. I'm the executive vice president and chief quality officer for the Guthrie Clinic.
Isn't it hard to believe that it's been a year into the pandemic, and you think of how much even each broadcast we've had together has changed from episode to episode?
Yes, it's really remarkable. It's been a year, and within that year, it almost feels like there's been 4 or 5 sub-years from the early spring when we were waiting for a wave to come to the Twin Tiers, to the summer when it looked like there may have been an early light at the end of the tunnel, to certainly the last 4 months, which have been pretty challenging for the healthcare systems everywhere in the country, and including the Twin Tiers. And now maybe spring is coming. So definitely been an interesting year and complicated.
And each one of those phases has had a different challenge. We began talking a lot about PPE. We were able to get past that difficulty, and then we were talking about testing and the availability of rapid testing. Sort of get that passed, and we have hospital capacity. Challenged in making sure we had enough hospital beds to take care of our patients, and now it's the vaccine. So it seems like with each phase, there's something different that we are learning about and handling.
Yep, some unique circumstance that goes with each phase.
Well, and the phase that you just mentioned, and the words light at the end of the tunnel were mentioned as well, the vaccine. We've all been very excited about the beginning of the vaccine rollout. How has the distribution process been going so far at Guthrie?
So we think it's been going really well. The challenges, as we've seen all along, we have 2 different states, slightly different indications for each state, but we've been able to get a really pretty nice vaccine supply for our area. And we've been pleased to be able to get a lot of people through some of our larger sites that we've put together, as well as some of our offices. And so the response has been wonderful. People have been excited about getting vaccinated, and we know that's an important part about moving forward with the next phase of the pandemic.
There's definitely been a nice rhythm for us in terms of the vaccine supply and then establishing the vaccination dates, and the public has been really cooperative. So it has gone remarkably smoothly, maybe more smoothly here than in a lot of other parts of the country.
I have heard some people say that they're going to wait for such and such vaccine, or they want to know which vaccine they have. What do you recommend when it comes to picking and choosing vaccines?
The differences between the 3 vaccines that are available today are small, not significant enough to warrant a patient waiting. But Mike?
Yeah, I think that's absolutely right. I think what's most important is the vaccines are very protective against severe disease and hospitalization. Those subtle differences really are not worth making a decision based on what manufacturer. The first vaccine available is the one people should accept.
I believe the data to date shows that there's essentially no hospitalizations or deaths in the population that's been vaccinated. You know, that's an important distinction, because a lot of the conversation is around whether it's 92% effective or 96% effective, and that's about preventing the disease altogether. But what appears to be more important to the healthcare systems, I think, and to our concern for patients' well-being, is essentially no hospitalizations and no deaths in the vaccinated groups. And that's an important message for the public.
And we've been encouraging people, of course, to get the vaccine. Like you said, does not matter the brand, get the vaccine. So how can someone make an appointment to get the vaccine at Guthrie?
So there are a couple of ways. What's important to know is that our notification of when vaccine is going to be available is actually very shortly before it exists. So we don't have a lot of lead time to be able to open up appointments and let the public know. We usually have somewhere 12 to 24 hours before it arrives to know that we're going to have enough and how much to be able to offer to the public. So what we've done is we have a couple of different mechanisms. We have our website, and so we encourage people to watch our website to see when those will be available. We use press releases. Our communications department will put out information that way. And then there's a phone line that people can call to schedule. So there's a number of different mechanisms to be able to know when we can get that vaccine. And we work really hard to get that information out as quickly as we can, and also equitably, so everyone has a fair chance to be able to get vaccinated.
I think the public knows this, but just to be certain, we're told, as Mike mentioned, a day or two ahead of time that the vaccine is coming, and then we have a very short window, 6, 7, 8 days, to use that vaccine on our patients. That drives the communication strategy. It makes us have to get the information out quickly, schedule the appointments quickly. And one last thing, we are not allowed to schedule a vaccine for a patient unless we have vaccine on hand. So we can't have a pre-scheduled clinic set up.
We've asked the public to send in questions to ask you, the experts, and I'm going to get to those a little bit later on in the program, but I think one fits here perfectly, and it's Robert from Campbell, and he says he has no computer, he's 65 plus, no health insurance, so how does someone like him get a test or get the shot?
So I'll start with that last part first, and this is important, that the vaccine is free, that no one will be charged for being vaccinated. The federal government has made that clear, and we want to make sure our patients understand that. There are aspects of it, if someone is insured, that their insurance could possibly be billed for part of it, but patients will not have any cost for getting vaccinated uniformly, insurance or not. The second part is we understand that there are a number of people who don't have good internet access or have a computer. And so we do have a phone line that's available. But also we would ask friends and family, really try to help those people. Recognize who they are, and work to be that colleague, that friend, that family member that helps them to schedule an appointment when they're available.
Why is it important that people remain vigilant in stopping the spread of the disease while we're in the middle of this limbo phase where some people are getting vaccinated and some are waiting to be vaccinated?
So that's a great question, and we understand it's really hard for the public. Everybody is ready to be done with this, but the vaccine, as effective as it is not perfect. There are some individuals who, even when vaccinated, could still catch the coronavirus, and so because of that, and because of the fact that we do not yet have most of the public vaccinated, it's important for both protecting someone else and protecting yourself to continue to social distance and to wear masks as it's recommended.
I'd like to send our next question over to Big Fox News COVID-19 specialist, Amanda Decker.
And what are we learning from the CDC about gathering without a mask after vaccination?
So this, of course, is really welcome news, and we're all excited about the opportunity to be able to get out and see some friends and family a little more closely. There are a couple of important caveats that people need to understand. The first is the gathering is really about people who are fully vaccinated. And fully vaccinated means 2 weeks after either their second shot of Moderna or Pfizer, or after their Johnson & Johnson vaccine. And then small groups are still what's being talked about with the CDC. These aren't large gatherings or even medium-sized gatherings. These aren't out in the public where potentially more people could be unvaccinated or exposed. But we do know that if you're in a small group and everyone is fully vaccinated, that we believe that is highly unlikely to transmit virus and that people are safe in that situation.
So I would add, the CDC's message really sends two messages that are kind of underneath the detail. So one is that we are making progress, which is new from a month ago, so that there's now progress enough in immunity that people can gather together in limited circumstances. But the second message is we are not across the goal line. The limitations to a single household and low-risk patients interacting with vaccinated people really underscores that we are not across the goal line yet. So it goes back to that vigilance that's still necessary.
Why is it important for people to realize that continuing their routine care is vital and it's safe?
So I think that safety message is really important. We have learned a lot in the last year. Now as we've gone through all these different phases that we talked about earlier, we know how to protect people in our institutions. We know how to protect people in our hospitals. And because of that, we can get back to a lot of our important preventative work and our routine care. So we don't want people to delay their screenings, whether it's mammography or other types of cancer screenings. We don't want them to not come into their physician's office to be able to get that care for their chronic diseases. And we really want to make sure that people maintain that important health care.
And it's been a year. That's a long time in your healthcare life to have delayed or not concluded medical care.
We'll go now to the questions the public sent in, and we appreciate everybody who sent a question or called. Should you take Tylenol or ibuprofen after your shot? And on top of that, I'm going to piggyback off of that. What do you do after the shot? What don't you do?
So that's a great question, and people ask this very frequently. There is a little bit of science behind it, and some of it is a little bit common sense. So what we believe now is that prior to the vaccine, people should probably avoid either Tylenol or ibuprofen. But after you've been vaccinated, as the symptoms begin, that some people might have side effects, it's fine. It is definitely safe to be able to take Tylenol or ibuprofen to manage those side effects if you have them. But we still recommend that before. Try not to take it within a few hours before your vaccination.
Next question. Do I still need to wear a mask if I've received both vaccines?
Yes. The only exception as of right now is the CDC is pointing out is that a vaccinated individual can meet with a family member, very small gathering in a known household, if that household, all of the household members are low risk. That is the only exception to requiring a mask. But right now it's still pretty limited.
And locally, how has the response to the vaccine been? What have people's reactions been?
We have seen the gamut of emotions, but all founded in gratitude and relief. The anxiety to get on the list, get the vaccination is high, and the relief factor once you're vaccinated is amazing. There's still some resistance. There's still some fear about getting the vaccine, but the people who are coming for vaccinations are just very happy.
Well, and you mentioned gratitude, and we're all so grateful for this whole year's worth of work of just, I'm sure, stressful atmosphere for all the employees at Guthrie. How are they all holding up, and are they excited that they're finally able to jab people with a vaccine?
Our staff have been remarkable. We've done a lot of this work with some volunteer staff, individuals who are spending their own time to be able to make sure our public and our community gets vaccinated. So the response has been overwhelming. It's really been gratifying to see how pleased and helpful our staff have been, despite the hard work they've been through in the last year, to step up once again and help the community by working in these vaccine clinics.
Well, I want to thank you again for being a part of this panel discussion, and I love that we're talking good news with vaccines, so I hope that we can talk again soon.
Okay, thank you very much, and have a great day today.
Thank you.
And now we'd like to welcome our friends with Arnot Health. If you could please introduce yourselves.
So I'm Jonathan Lawrence, President and CEO of Arnot Health.
And I'm Dr. Justin Nistico. I'm one of the infectious disease specialists here at Arnot Health.
Well, thank you so much for joining us. You know, it's hard to believe that we're basically at a year now, at least in our region, of the pandemic. So you've been front and center during every phase and every segment of this. What's your impression of where we're at today?
So Dr. Nistico and I have just been discussing how heartening it has been to see the progress that we've made, the numbers of patients that we're seeing coming to our emergency rooms, coming to our clinics, coming to our testing sites, and in our hospital have reduced dramatically. And so that has certainly been a welcome sign of progress in the battle against this pandemic.
Now, how is Arnot's vaccine distribution process going? What are some of the challenges? What are some of the things you're learning from?
So we're extremely proud of the impact that we have made in a relatively short period of time. Naturally, like all the other hospitals and organizations that are administering the vaccine, we are waiting for vaccine supplies because there's simply still not enough for everyone who wants vaccine. And so it is a week-to-week changing situation. Some weeks we get no vaccine, other weeks we get an abundance of vaccine. This week we had enough vaccine and we were able to share it with the county to support their efforts. And we're looking as the J&J, the Johnson & Johnson Janssen vaccine, becomes increasingly available. We have an expectation that there'll be more consistent deliveries and allocations of vaccine, not only to Arnot, but to all the facilities in the region, to the local health departments, and to all the entities throughout the region.
What is the difference, and what do people need to know about the difference in the brands of vaccine? Because I've been trying to encourage everyone, just take the first one you can get. Don't try to pick and choose. So what is your opinion, being the expert?
If you are given the opportunity to get any vaccine, it's important or imperative to receive the vaccine. Now, the differences are we have vaccines that are called mRNA vaccines, which are the Moderna and Pfizer vaccinations. And then there's something called a viral vector vaccine, which is specifically the Johnson & Johnson vaccine that is currently being rolled out. Now, the difference is that the mRNA vaccinations are two-shot vaccinations. They are highly effective at preventing COVID-19 infection, and that's been shown in the initial data. And then the viral vector vaccination, or the Johnson & Johnson vaccine, is a one-shot vaccination that is effective at preventing severe COVID-19 as well as hospitalization and death, which is very important to know. Now, it's also very important to know that all of these vaccinations have no preservatives, they're latex-free and they're egg-free, and also they're free of COVID-19. There is no COVID-19 virus in any of these vaccines. So if people are hesitant because they're worried about receiving vaccines that have low levels of COVID-19, there is no COVID-19, and I'll repeat that, in any of these vaccines.
And this is from Brian N. in Corning, and he says, how long after the second vaccine until it has reached full effect?
After receiving your second vaccination, typically we see within a few weeks, which 4 weeks is what's been kind of thrown around as the number. If you take the Johnson & Johnson vaccination, in their preliminary press releases and data have shown as early as 2 weeks in terms of reaching full effect, but they anticipate the 28-day mark for Johnson & Johnson. Now, if you're getting the two vaccinations, the second vaccine, usually within a 4-week period. Everybody is different, so each individual person has a different way in which their immunity will react to the vaccine. So some people may reach peak vaccine immunity earlier than others, and it really would depend upon that individual's immunity. So just be prepared that after you receive your second vaccination, it is important to know that after receiving it right away, you may not have the full vaccine effect. It will take some time. But being that it takes even a few weeks, obviously we will still need to stay vigilant against the fight against COVID-19.
Now, how can someone make an appointment to get the vaccine at Arnot?
The easiest way is to go onto our website, arnothealth.org. And whenever we have a vaccine allocation available, there will be a button to click on that website, and it will bring you to the scheduling page where you'd be able to sign up for the vaccine. If you do not have access to the website, don't have access to a computer, you can call our COVID-19 helpline at 1-800-952-2662, 800-952-2662, and somebody will be able to assist you when we have the vaccine. So again, everybody has to understand that we are waiting on vaccine on a weekly basis right now. We do not have any first dose vaccine appointments available to be scheduled as of this afternoon. And so the next time we get an allocation, we will make that available on the website, and it will clearly indicate where people can sign up and become scheduled.
Why is it important that people remain vigilant in helping to decrease the spread of COVID right now in the vaccine process?
As more and more individuals get vaccinated and as more time goes on, more people will have developed immunity against the COVID-19 infection. Now, it's very important to say when you get your vaccine that you continue to hand wash, you continue to socially distance, and you continue to wear face masks, because there are going to be individuals in society who cannot get the vaccine or have limited access to get the vaccine or have not been vaccinated yet. So those individuals are still going to be vulnerable to getting COVID-19. And even if you had received the vaccine, it is not considered bulletproof where you are completely immune from getting COVID-19 infection. It helps you tremendously in fighting against COVID-19, but it is important so that when we are trying to prevent community spread or spread of COVID-19 infection, that as we continue to do what we're doing, which has been great in the society with social distancing, face masks, and hand washing, that we're starting to see the numbers tremendously decrease. And we want to continue to see that well into the spring and summer so that, we continue to have a return to normalcy.
We now go to Big Fox News COVID-19 specialist Amanda Decker to ask our next question.
And locally, how has the response been to the vaccine, both in terms of numbers of people who have received it and their reactions?
The response has been considerable. As we've said, our appointment slots for the vaccine fill up as quickly as we are able to post them on the websites. And we have been working through long waiting lists of people who are seeking the vaccine, not just from Arnot, but from any of the authorized organizations and entities that are administering the vaccine. People are incredibly grateful, they're appreciative, and our staff have been proud and privileged and thrilled to be able to help administer the vaccine to so many people. We've taken special interest in making sure that we are focusing on the underserved populations, people with special needs, both physical needs and emotional needs, people who are living in congregate housing and don't have the ability or need additional support for seeking medical services. And so we have been standing up these mobile pods, essentially mobile teams of staff and volunteers who go out and go to the places where these individuals live and work with their sponsoring agencies and their organizations to make sure that we're getting people who may not have access to transportation and need additional assistance and support in being vaccinated. And so really, it has been a tremendous collaborative effort that's been coordinated by many disciplines across not only many departments in our organization, but across organizations and throughout the region.
What are you at Arnot doing to encourage people to continue routine care? Is it safe to continue the routine care?
Yeah, not only is it safe, we are definitely encouraging people to get routine care. One of the tragedies that we've spoken about before about COVID is the fear of seeking access to medical services when the risk of getting COVID is much less than the risk of a potential heart attack or a stroke or other serious medical condition. And we have seen people come to the emergency room in a state that could have been avoided with a condition that could have been treated at a much less serious stage had they not given into that fear of getting COVID in the hospital. We are continuing our processes of making sure that our rooms are sanitized, our surfaces are sanitized, our staff continue to wear gowns and gloves, and you can see Dr. Nisko and I are both masked here. We continue to engage in the practices that we have espoused all along throughout this crisis. And so your chances of getting COVID in the emergency room or in your provider's office, if you have symptoms of a stroke or a heart attack or other serious condition, are much less than that condition. So please, please, please come into the facility, make a call, make an appointment, call an ambulance if you're having chest pains, if you're having symptoms of a stroke or heart attack or other serious condition.
Now we go back to questions that we received from the public, and we thank the public again for sending these in. What if I didn't get any of the side effects when I got the vaccine? Does that mean it was less effective?
In general, it doesn't mean it was less effective. Some individuals that have been noted there are many different reasons for this, but individuals that are between the ages of 18 to 59 have had more side effects from the vaccination, but it's not to say those side effects are severe. It might just be that those individuals have had some inflammation associated with the vaccine. They are usually transient, they are very safe, and they resolve on their own. Now, if you're over the age of 60 or 60, individuals have less of those side effects, but it doesn't mean those vaccines didn't work. They have shown effectively in those groups of individuals that COVID-19 has significantly reduced in individuals that have gotten vaccinated. And we're starting to see that now more and more with the cases that we're seeing have been decreasing in the surrounding counties. So it's not to say that the vaccine didn't work, and you shouldn't be alarmed by that. I think the biggest thing to know is that just make sure that you're following the protocol of the vaccination site that you are to return for your second vaccine. To just receive one vaccine out of the 2 vaccine series is not enough. And that's a very important point, is that the individual who gets the vaccine should receive all vaccinations that they're slotted for.
But what should people do and what should they not do after they get their second shot?
The things that they're supposed to be doing after their second shot is making sure they're monitoring for symptoms. And obviously, if they're monitoring for symptoms and they notice a symptom that's concerning, they could obviously have a discussion with their medical provider about that symptom. And what's important to know is that, you can receive some symptoms post second vaccination, and you shouldn't be alarmed by that. And they are, like I said, transient, they are safe, and they do resolve on their own. Now, things you shouldn't be doing is that you shouldn't be taking tons of Motrin and Tylenol. You should be obviously making sure that you do rest. If you do have a fever or are not feeling well, you can call your medical provider, but it is important that if you're going to monitor for symptoms, things that you would want to do is just make sure that, you could be checking your temperature and your arm soreness. A lot of the times people may develop some arm soreness, which is very common, that they're making sure that they, monitor their pain, and they could use, either warm compress, or they could try to do some resting of the arm. Try not to do too much heavy lifting or heavy exercising at that time. But once the patients or individuals feel much better, they can go back to their normal routine.
And just before we go, how is the staff at Arnot? They've been there from the beginning. Like I said at the very top of this, the frontline workers, they must be excited to be getting the vaccine rolling out.
They are. We've often heard the expression, it's the light at the end of the tunnel. And it has certainly been, as we mark, the 1-year anniversary of COVID in the United States this week. It has certainly been a very challenging, long, hard year for all of the frontline workers in the organization and all of us. We have felt the emotional, the financial impacts, and certainly the physical impacts on us and our families. And no more is that true than with the folks who are actually caring for the patients at the bedside. And I'm just incredibly proud of the work that our physicians and our nurses and the rest of our healthcare professionals throughout the entire system have done day in and day out to take care of thousands of our community members at our testing sites and on the inpatient floors and in the emergency department and in our ICU, and not only the patients, but their families as well. And so this is truly a bright light for all of us right now to have this vaccine. And we see this because of the enthusiasm that our teams have come together and they're working days and nights and weekends out of a sense of dedication and excitement to be able to give the vaccine to so many of the rest of our community members.
Great. Well, thanks again for joining us.
Thank you.
We'd like to thank everyone who submitted questions for our panel of experts. And thank you for watching another informative discussion on COVID-19 with Guthrie and Arnot Health on WYDC TV, Big Fox, brought to you by Excellus Blue Cross Blue Shield. I've been your host, Frank Acom, and until next time, stay safe.
This informative discussion on COVID-19 has been brought to you by Excellus Blue Cross Blue Shield.